Greetings, class. Let's take a look at Competency 11. So just a quick look at different competencies and different domains we covered. We covered well-cultivated self-awareness. That's where we started with two competencies, the leading with conviction and using emotional intelligence. Then we looked at compelling vision, how to come up with a vision and how to communicate the vision and how to make sure that we align to the vision that we stated. There are three competencies. Then you have the real way with people. We covered the last competency in the last session, the competency 10. There was 5 competencies with a real way with the people, how effectively the different paradigms by which we would connect with the people, establishing that true relationship, genuine, authentic relationship. And now we are jumping into masterful execution. So the word itself communicates so profoundly that it's not a normal execution or normal delivery. How do we champion? How do we build that supreme effect into that delivery? So each of these domains, as well as each of these competence, Carson and Andrew uses adjectives where you can see they have taken that competency to the highest level. Exceptional leadership, not just a regular leadership, exceptional leadership. So similarly, it's masterful execution or masterful delivery. So execution, as many of us know, it is truly the bridge between vision and reality. So without execution, even the best idea would remain only as a dream. So exceptional leaders not only develop strategies and inspire people, but they ensure that those strategies are implemented, goals are achieved, and progress is sustained. So in masterful execution, there are 6 critical competencies. So we will finish, this is the last domain, and we will finish the final 6 competencies here. So generating informal power is the very first one that we are going to discuss today. How to influence without that authority. Number 2 is building through consensus. How to gain the buy-in and the alignment with the team who is committed for delivering the project. Mindful decision-making, not just a regular decision-making, but how is it thoughtful, balanced with choices under pressure, and having that mindfulness in that decision-making. Then we will look at the result, driving results, how to stay focused and deliver outcomes that truly matter, stimulating the creativity, how to foster innovation and new ideas, and finally, how do we cultivate the adaptability? Because nothing remains status quo, everything changes. How will we remain flexible in today's rapidly changing environment? So as we go through these 6 competencies, I want you to think about your own leadership experiences. Where have you struggled with execution? Where have you seen leaders succeed or fail? Because they either mastered or neglected one of these skills. I haven't seen truly a leader who has championed all of these competencies. So the textbook-based competencies and the textbook-based evolution of leadership is going to be different in reality. So these are all framework that will help us understand our true strength and also determine and also help us focus on our areas where we can improve on. So once you have the 16 competencies, or once you're aware of these 16 competencies, it will help you understand, it will help you draw out a roadmap on where and how you see fit based on the different organizations that you are leading. So by the end of this domain, you will see how masterful execution connects all the other leadership domain together, turning the true vision into the project, into project that can be delivered with impact. So let's go to the next one. What is informal power? And why does it matter? So very similar to all of the other paradigms that we have seen. What is that competency? How does exceptional leaders show that competency? Then if that competency falls short, what would be the result? Then you look at the other spectrum, the misuse and overuse of that competency, and then you focus on how do we, as a leader, improve that particular competency, and finally the summary of it. So that paradigm is, hopefully, that framework is structured in your mind. So let's take a hospital. Let's take ICU of the hospital. That's where action happens all the time. So let's say physicians in ICU have the highest authority because they decide what kind of treatment administration, what kind of interventions, what kind of protocols that needs to be administered for every patient. They lead literally the care team. But when a crisis hit, a patient suddenly coded. So in that situation, it was not always the physician who held the room together. Most of the time, what I have seen is an experienced senior nurse will hold that particular situation together. So nurse don't have the formal title of leader in that hierarchy, but everyone look forward for that particular nurse's calm direction. She knew the team. She knew the workflows. She has built trust over years of experience. And when she spoke, you get the crash cart. You start compression. You call the family. People listened and acted immediately. That's the informal power in action. It's the ability to influence without relying on formal authority. Informal power matters because it shapes decisions, it resolves conflict, and inspires action in ways that titles or formal powers cannot. We see this all the time in healthcare, especially like all of these smaller, I wouldn't say smaller, all of these focused units where chaos, where action with very limited notification should happen, can happen, may happen. Let's take surgical team. A scrub team may not have the authority to overrule a surgeon, but by quietly pointing out that an instrument is in sterile, they prevent harm and they redirect the whole team. Or think of a case during the COVID-19 pandemic. Respiratory therapist, often overlooked in traditional hierarchies, they became the most critical influencers during that time frame. They taught physicians how to optimize the ventilator settings. And during those times, the protocols changed daily based on the patient situation, based on what they learned from the disease, based on the availability of supplies, based on the oxygen, so on and so forth. So their expertise in understanding the optimization of ventilators and ventilator settings gave them the informal authority that directly impacted the survival rates. What this shows us that the formal leadership may give someone the title, but informal power determines whether the team can truly function under pressure. It's built through trust, credibility, and consistent action. So when we talk about generating that informal power, we are not talking about manipulation or politics, because some people, you would see characters within your team or outside of your team who are masterful in manipulation tactics or politics, or he said, she said, or changing the mindset of leadership or executive leaders. That is not what informal power means. We are talking about the quiet influence that comes from credibility, that comes from relationships, that comes from trust, that comes from the value that they bring to the table, and finally, their ability to guide others when it matters the most. So, manipulation and politics would be the negative side of the equation, whereas credibility, relationships, trust, ability to guide others when it matters most would be the real informal power on the positive side of the equation. So now we know what is informal power and why does it matter. Let's take a look at how effective leaders generate that informal power. First, they approach power strategically. They don't leave influence to chance. Instead, they continuously build trust and relationship with intention. For example, in a hospital, a department director who regularly walks the floor and listens to the staff concerns build credibility long before a crisis arises. With that same director later championing new patient safety, people are already on board because they know their voices have been heard. Influences were built deliberately, not accidentally. Number two, they are efficient with power. Informal power is like a currency. You can spend it wisely or you can completely waste it. A charge nurse, for instance, might only step in to override a workflow if it is truly critical for patient care, rather than interfering with every minor decision. So by using influence sparingly, the nurse's voice carries more weight when it truly matters. And that's credibility in action. Third, they return favors. Trust grows strongest when it is reciprocal. Let's take a look at a scenario or a case. Let's imagine there is a sudden patient surge in ICU. So one ICU nurse used her strong relationship with radiology and lab teams to explore options by which they can secure urgently the lab test, radiology test, and other resources. Why would those teams respond so fast? The only reason those teams would respond fast because the nurse had consistently supported their departments in the past. So she wasn't cashing a favor out of nowhere. She was drawing on years of reciprocity. I think there's a word, reciprocity and goodwill. So this is the key. Informal power is not about control. It's only about relationships, credibility, trust, and influence that accumulate over time. So highly effective leaders know that their ability to influence in critical moments depend on the groundwork they have laid in everyday interactions. Let's take a look at some other examples. I mean, you will have a lot of examples that you can see during the course of your career trajectory, as well as personal. So this is every competency we discussed. It's not completely bordered by the personal or healthcare type of scenario. It can happen among your friends. It can happen within family. It can happen between spouse. It can happen with the children. So it is something universal. It's not just healthcare competency. Let's take a case of a pharmacist in a hospital quality committee. She doesn't have the final vote like the medical director, but she built the influence by consistently bringing well-prepared, informed data on medication errors. So over time, physicians and administrators turn to her for her insights in making decisions. Remember, she does not have the formal authority, but she had become the trusted voice in the room. So if I underline what and how she gained that informal authority, number one, consistent. Number two, well-informed, well-prepared data on the subject that she has her expertise. Now let's take a look at physical therapist. So physical therapist may notice that a post-surgical patient is at risk for fall because of the poor coordination. So instead of pushing the issue aggressively with the surgical team, he waits until the right moment during multidisciplinary rounds to present his observation with data from a simple gait test, which is a very commonly used PT test. Because he uses the influence judiciously, rather than going into all the details, the surgeon listens carefully when he speaks up. So there are several intentional pointers that I have placed in this section of describing a PT. So do not go into pushing the issue aggressively with the surgical team. Wait for the right moment. A multidisciplinary round is when you have the ears of everybody, not just surgeon. There is attending physician, there is PT, there is definitely surgery team, there is nursing team, all of the right team members who are responsible to take a decision for a particular patient. And his observations are supported with well-rounded data. Let's take one more example. In one hospital, the infection control nurse, she regularly supported the emergency department by providing quick data when outbreaks are suspected. So she continuously supplied that. In business side, I have heard many people who build relationships with others by offering market reports and research reports when it comes to your table to several groups or several people who might need them, who might have had the chance to look at that, who might utilize those references in their work. And later, in this case, when the infection control team needed that urgent compliance, they were able to prevent a hospital-wide outbreak because they had all the information with them. And they needed that help from the ED, and the ED staff responded immediately. So they knew that this nurse had always backed them up. So they reciprocated with the trust and commitment. So it is always what you give, how that information is relevant for other group. And when crisis happens, now you can depend on them. Now, let's take a look on the other side. While we discussed informal power can be a huge asset, it can fall short when misused or misunderstood. Undervaluing the informal power. Some leaders miss hidden influencers in their organization. For instance, hospital administrators can overlook the role of a well-qualified, well-respected senior nurses in shaping the workflow changes. Policies can be rolled out without engaging them. And the result was resistance, as you could imagine, slow adoption, and eventually it will fail. Why? Because informal leaders who carried the staff's trust weren't consulted, involving the wrong people. Sometimes leaders invest in the wrong network. I remember working with a healthcare system where a department head always leaned on a popular physician. This guy had lots of charisma, but he lacked operational knowledge. Unfortunately, the leader assumed that physician's influence would move initiatives forward. But instead, it created confusion, it created expectation, because popularity was mistaken for competence. Third, using ineffective approaches. So networking is absolutely a must, but networking alone isn't enough. What matters is consistency and follow through. So a mid-level manager built a reputation as a connector, but rarely followed up on commitments. Over time, staff stopped trusting her influence because she overpromised and underdelivered. So her informal power, you would imagine, eroded. And when real crisis came, no one turned her for guidance. So think about a department head who might rely on popularity rather than expertise when making decisions. Initially, they will be able to rally people, but soon the staff will get frustrated when the decisions don't translate into effective outcomes. And that gap between popularity and actual problem solving damages the credibility and weakens the team. Now let's shift the strength of informal power in areas where it is misused or overused. Because influence, when unchecked, can quickly undermine trust. So, focusing too much on personal agendas. I once worked with a hospital where a department chair prioritized gaining influence with the board over addressing patient safety issues raised by the staff. Instead of aligning that informal power with the organizational goals, it was directed towards self-promotion. Over time, the team became disengaged because they could clearly see only if your leader gets promoted again and again and again, and there's no recognition for the staff, the value of that leader will diminish very quickly. Everybody would see that the leader is using that informal power for his own or her own self-promotion. Number two, overvaluing relationships at the expense of work. So relationships are critical, but when leaders spend more time managing friendship than driving results, productivity suffers. For example, a manager at a cancer center avoided holding underperforming staff accountable because she didn't want to upset the close colleagues. I know performance improvement plans created for just for the sake of creating performance improvement plans, even though the entire team detected the eroding of performance over a period of time. Unfortunately, the manager still wants to, quote unquote, manage the friendship. So the over reliance on relationships led to gaps in patient flow, increased burnout among high performing team members who now have to pick up the slack. I remember when I joined the strategy department, it was a smaller department. The team members and the leaders have very close relationships built. When I joined as a manager, I was given the autonomy to assess every team member and to take the right step so that the vision of the department and the alignment of the team will be able to take what we want to achieve to the next level. But if that autonomy was not given, we wouldn't be able to do much in that department. So it is extremely important for healthcare leaders to understand the boundaries of friendship, the boundaries of leadership, so that it doesn't undermine the values, the trust, the credibility, the deliverables brought up by the department. Number three, playing power politics. This is probably the most dangerous misuse. I recall a physician leader who leveraged the personal influence to push the preferential scheduling changes. We probably know a bigger example at national level where business leaders who might leverage influences to secure growth of the company, to secure long-term contracts, to secure opportunities to influence policies and procedures. But all of those will fail because they are all examples of misusing the informal power. So initially, without knowing all of this, the staff complied. They would comply because it is something that is needed. But soon the resentment grew. There is no question about that. Truth at the end of the day will prevail, and the trust will get eroded very quickly because team members can see the decisions being taken to support one person, or decisions have been delayed to support one person. And all of those are surrounded based on unfair treatment of staff or team or department or a company or an industry by itself. And all of those have no roots based on the need, based on the fairness, based on the observations, based on what need to be done. But this is purely based on influence. So once trust is broken, regaining it is next to impossible. I've seen many situations, even trust between close friends. Once it is broken, it is very, very difficult or never possible to build it back. So the only thing we as individuals, we as employees, we as professionals, we as leaders can constantly try and put in place is not to break the trust or not even to give the perception that the trust is broken. So think about a physician leader who overused informal power for scheduling. It might benefit a few, but it damages the staff perception of fairness. It will lead to frustration. It will lead to low morale. It will lead to a high turnover risk. So informal power is like a strong medicine. It can heal when used wisely, but it can harm when misused. So leaders always must balance influence with integrity, ensuring that power supports organizational goals rather than personal advantage. So how do we improve on generating that informal power? Very similar to all the other competencies that we discussed. Find the role models who would use that informal power, who build that informal power, who would use that informal power very wisely. So when we hear the word power, we many times think about titles, directors, executive directors, vice presidents, C-level officers, chief executive officer, president, so on and so forth, or chief physician. But in real life, especially in healthcare, power is built through trust, relationships, and credibility rather than job titles. And it is very true on the clinical side of the house more than in the administration. Let's take the story of a young hospital administrator. So she has the education, the technical knowledge, but in meetings, her ideas would often get overlooked. Then she noticed something. Whenever a certain nurse spoke, the room paid attention. Not because the nurse had a higher title, but because she had credibility. She was trusted. People knew she understood patient care, and they knew She was dependable. So the administrator emulated that behavior and decided to learn instead of pushing harder. That's the first and foremost thing. When you get an opportunity to see a role model in action, that is the best training you will be able to receive at that point of the time. So, in short, she found role models. She shadowed those respected nurses, asking what makes people listen to them and answering those questions in silence. She saw that these nurses built influence not through authority, but through empathy and reliability based on grounded information, based on truth. They followed through on promises. They treated everyone with respect. And people turned towards them in a crisis. So, those professionals who operate on these behavioral trends, treating everybody with respect, with value, understanding what they bring to the table, capitalizing on each team member's strength, and then acting as an influencer whereby you would be able to deliver projects, bring that desired outcome effectively, not by stealing others' ideas, not by delivering a haphazard work for the sake of doing work, not by leveraging your informal power in influencing someone or killing the project, because all the other team members are observing one another knowingly or unknowingly. Let's take a look at this administrator's case. Let's go through the journey of this administrator and answer this question: how would we improve in generating the informal power? Number two, by approaching this nurse, she built that cross-departmental relationships. Many administrators may stay in their office, may only interact with their own teams. Either they will be over a surgery or they will be over one of those service line departments. So they pretty much will be within the realm of the scope of their responsibilities. But this young administrator, she intentionally made rounds. She visited radiology. She chatted with the ICU staff. She spent time in the emergency department. Over time, people didn't see her as management. They saw her as a colleague who understood their pressures. And that made her voice stronger in decision-making conversations. Because now, knowingly or unknowingly, she is built on information through observations from a range of departments over a period of time. Number three, she sought feedback. Early on, she realized her communication style was too directive. People felt she was telling them what to do instead of coming across as collaborating or collaboration. Her intention was she wanted to collaborate. Many times we all, when we go through the journey of maturing, we sometimes comes across as directive rather than grounded and working with the team member and collaborating and embodying an empathetic collaborative style. So this young administrator asked for feedback. Sometimes she received the feedback which are hard to hear, and she intentionally made adjustments. That humility made her more approachable, and people began to welcome her leadership rather than resist it. And finally, she used her influence ethically and transparently. So, influence can be misused in order to push personal agendas, in order to play politics, in order to cut the corners. This young administrator resisted all that. Instead, when problems arose, she used her connections to remove the barriers, to solve issues, and most importantly, giving credit to others. Remember that last point, credit to others. People trust you more when you use your influence to elevate others, not yourself. If ever, class, you think you are using your influence, your informal power, and sharing the weakness, sharing how others are not doing good, think about what you're telling the leader. You're telling the leader that you will be saying about that particular leader to his or her boss that how bad they are. So every time you speak bad, you speak ill about others to a leader, underscore that is a misuse or overuse of informal power. You always need to find the strength of the other people. And by discovering more and more strength, the capacity of the strength will expand. I have experimented this while building high performance teams in different organizations. You give me a team who is underperforming on all categories. I can guarantee you, in 12 months, I will be able to transform the team into a high performing team. That assurance comes to you with years and years of building those high performance team who can perform exceptionally well in different domains. A true leader is someone who can transform their team beyond what the team can imagine. A true teacher is someone who can take a student into possibilities, into realms where the student couldn't even imagine that they would be able to reach. A true mentor is someone who can take his mentees to a level where the mentees couldn't even imagine possible. So all of this shows that informal power is strongest when grounded in competence, trust, and integrity. So how do we improve in generating the informal power? You don't just wake up one day with it. We earn through small, consistent actions, building trust by following through, expanding our network beyond our immediate circle, asking for and acting on feedback, and above all, being ethical and transparent in how we influence. So this is a very powerful competence which I would like you all to reflect and think about your workplace. Find out who hold the most informal power. I remember when we used to roll out enterprise project, the very first thing we do is building the web of politics. We chart down every leader. We understand how that leader is connected with each and every team member. And with that, we will be able to consciously, intentionally, strategically understand who is connected to whom. Once you understand that, then you will be able to answer the question, what makes them influential? What characteristics, what knowledge, what skill, what attributes drive that influential trend? Now you can ask the question, what strategies would you adopt to strengthen your informal power without relying on titles? In fact, if you are somebody who's part of the staff, this is the best opportunity by which you can connect with leaders, you can learn from them, understand them, and start building that informal power. Now, you might have seen how informal power has been misused in your own department. How did it affect the trust? How did it affect the collaboration? How did that took away the psychological safety of the team? How did it derail the way the team operates together? So this is one competence that each one of us should build consciously so that we can glue and keep the team together. If you're using the power to promote yourself, to showcase that you are bringing something to the team which others do not have, if you are using informal power to lower another team member or a team or a department, if you're using the power to showcase the weakness of processes and bringing other individuals down, the leader who is listening to your informal power stories will know that tomorrow you're going to do the same thing with leader, and they will be very, very, very careful. So informal power, I would say, is the epitome of the healthcare, exceptional healthcare leadership. Without having that authority, supreme authority, you have the ear and voice of that particular leader. So you have to use it very, very wisely. So as we wrap up our discussion on informal power, let's take a pause and reflect on why this competency matters so much, especially in healthcare. First, informal power is essential because it goes beyond authority. Titles may give you the right to speak, but the informal influence gives you the ability to be heard. Many people with title during crisis will turn the tables for the leaders, for the staff who has the subject matter expertise, who is well trusted, who has demonstrated his or her credibility over a period of time to speak. We discussed the senior ICU nurse. We discussed other physicians who has the authority and title, using it and misusing it in different occasions. Second, effective leaders knows how to use informal power strategically, ethically, and efficiently. Influence should never be about manipulation. It's about credibility and trust. When leaders use informal power to remove barriers, to intentionally support the staff, and create alignment, they build a foundation of respect that formal authority alone can't guarantee. But we must also acknowledge the danger of misuse. Misused informal power, like favoritism, personal agendas, or politics can very quickly erode the trust. I have so many examples, especially department leaders who would use their influence to push scheduling preferences, their personal scheduling preferences. And when that happens once, the staff may take it easy. But when it happens consistently, the staff would notice it. And suddenly, what you the leader, they would perceive that this is a source of division. The credibility will disappear over a period of time, and the leader's voice will not be heard. So the balance, informal power, must always calibrate and align with the organizational goals. In healthcare, what does that mean? Better patient outcomes, stronger staff engagement, effective crisis management, aligning the team towards goals bigger than you. So, especially in pandemic, much of the frontline response dependent not on official titles, but on the ability of informal leaders. They would be nurses, respiratory therapists, and even support staff who built knowledge, who built observations, who built their experience on a day-to-day basis and can effectively communicate and share with a larger group of people. So those who can coordinate under pressure, who can effectively share knowledge and support one another would become that informal leader. So the big takeaway, informal influence is often the deciding factor between a team that merely functions and a team that would thrive under pressure. If a team comes to you and tells you that they can thrive under pressure, producing marvelous deliverables for an unrealistic deadline, and that too without few team members, that speaks volumes. You as a leader should definitely listen to what they have achieved. Your goal is to build a psychological safety, a safety net where these team members can interact and consistently replicate, whereby the team can grow beyond what they thought they would be able to achieve. Because they earned the trust, they inspire action, they collaborate and guide others when it matters the most. So this is a very, very powerful competency that comes naturally to us. In some cases, where we should have the conscious way of gearing it or motivating it or guiding it for the positive side of the house, and be conscious about the negative impact or influence that we brought to the table and creatively remove it so that we can build this competence and bring that competence to reality, whereby we elevate the team consistently. Thank you, class, for listening to this lecture.